have severe headache, especially headache of a frontal nature. When I say frontal nature, I mean like right here, so your forehead. Yeah, you see me rub down my forehead? I've been noticing a lot of pregnant women, especially when they come to my clinic, like them literally are watch, like them a security guard, right? Hi guys, it's your girl Ren or Midwife Nelson, and welcome back to another video. So today, based on the intro, you already know it's midwifery minutes. I have decided to incorporate some very short and spicy teaching sessions. Yeah, girl is a midwife, is a registered midwife by profession, so I definitely love to educate my pregnant mothers. So that's what this is all about. Yeah. So today's topic is the signs that you should never ignore when you are pregnant, right? And I'm going to try to break it down to you as simple as I can. Yeah. So the first one is never ignore yellow, green, smelly, offensive vaginal discharge, right? So during pregnancy, the vaginal discharge tends to get more, right? And this is normal. It's normal for you to have, I don't know which pregnant mother don't have increased vaginal discharge yet, but and the increased vaginal discharge is really caused by the increase of hormones, right? So it's totally normal for you to have increased vaginal discharge, but it's not normal when that discharge is yellow, green, smelling offensive, right? In the event that the discharge is abnormal, you definitely need to speak to your midwife, speak to your OBGYN, come to the clinic, go to your doctor, right? Don't just sit down and watch it and think it's something normal. It's not normal, right? Number two, if you realize that you have burning upon urination, it's not a good sign, right? You definitely need to get that checked out as well. It could mean that there's some type of infection present, so you definitely need to come and get that checked out. Number three, never, and I mean never, ignore vaginal bleeding or spotting while you're pregnant. It is not normal, right? It could mean that, especially like if you're in the early stage of the pregnancy, because vaginal bleeding in pregnancy at different trimesters may signify different things. In the early trimester, if you realize that you're having vaginal bleeding, it could mean that you're having a miscarriage, right? So you definitely need to come to the doctor, call your midwife, inform your midwife, and your midwife will let you know what to do. Or essentially, if you find that you're having vaginal bleeding, thing to do would be to just take up yourself. Don't bother sit down on your yard and say you watch it. You need to report to the hospital, right? Number four, if you realize that your baby's movement has decreased, significantly decreased, or you are having no fetal movement, the baby now move none at all, that would definitely be a sign that you do not ignore, right? It could mean that your baby is in distress. So you definitely need to seek medical attention if you realize that your baby has not moved any at all for the whole day, or your baby's movement has decreased. Mind you, when you're in the third trimester, the uterus tends to, you know, have less space because the baby is growing, the baby is getting bigger, so there's going to be less space in the uterus. So you may not feel the same amount of, you know, movement like what you normally feel, because yeah, the room is smaller now, so the baby not gonna be able to kick out and behave and go on with himself or go on with herself. So, you know, that's a factor to consider as well. But if you realize that your baby's movement has always been a certain way, and then today you wake up and the baby does not move any at all, it could mean that your baby is in danger. Do not take it for granted. Do not sit home and say, oh, me go watch it, me go and watch it. No, that's a no. All right, next sign that you never ignore is severe headache. If you're right here, so you further pain you, further hurt you, right? Never sit down and ignore that. I mean, I've been noticing a lot of pregnant women, especially when they come to my clinic, like they'll sit outside of the clinic and they'll be having pain or something wrong with them, and legitly see them actually have one alcohol bottle a sniff up in them nose. It's not a good practice. All right, ladies, this is definitely not a good practice. All right, but back to the headache situation. Never ignore that. If you're having a headache of a frontal nature, it could mean that you're developing some type of preeclampsia or some issue bigger than that, right? So the next one that is related to the frontal headache is if you realize that you're having blurry vision, you're seeing wally, you're seeing flashing lights. This is definitely something that you do not ignore. It could mean that it could be a precursor to a condition in pregnancy called preeclampsia, right? So you do not ignore this any at all. Also, another sign that is connected to the other two that I just mentioned before is if you realize, say, your face is swollen, your fingers are swollen, your legs are swollen, you on a whole just you look swollen, right? And remember that in pregnancy you're supposed to be noticing yourself. You're supposed to be taking note of yourself, taking note of your changes, right? So if you realize, say, your foot swell, your face swell, your fingers swell, this is not something that you take for granted, right? And I know a lot of pregnant women tend to love to sit at home and say them and watch this and them and watch that. Like them literally are watch. Like them a security guard, right? Why? Don't do that. Don't stay home and, you know, having these symptoms, having these signs, and you say you're staying home to watch. Well, you still man watch, right? You need to seek medical attention, seek medical help, right? Another one too is if you're having cramp, and it links as well to like preeclampsia. You're having pain like where your ribs are in the middle, like right in your rib cage, right above your belly. Me I talking at your plain, me I talk it plain, so you can understand what I'm saying. You're having pain right here. We call it epigastric pain, but you're having pain, right? It could be some type of signal or, you know, some type of indication for something even, you know, more serious. So you don't just sit down and say, you know what, why may I have headache, may I have this, may I have that, and you know, me just go and watch it. I cannot stress enough that as a pregnant woman, you are not to sit home and watch the signs, right? The next sign that you should not stay home and watch, that you should never ignore as a pregnant woman, is if you feel a gush of fluid coming from the vagina, or the fluid is trickling out of the vagina, right? I mean, just a short story, a quick story, because I have a lot of stories, right? I remember one time I had this patient who she was having some trickling of some fluid out of the vagina, right? Homegirl was actually going into preterm labor, right? And when I talk about this fluid, I'm really talking mainly about you having fluid coming out of the vagina, your head water or your membranes rupturing before you are full term. Because remember that when you're full term, if your membrane ruptures, then that would be seen as something abnormal. But let's say you are under 38 weeks and you realize that your fluid a trickle out of your vagina, or you have this big gush of fluid coming out of the vagina, then you definitely need to act quickly and know that you are in preterm. You may be in preterm labor, right? So you shouldn't stay home and watch and say, "Me, I watch. No." But yes, let me get back to my little story. So I had this patient who she apparently she had some trickling of fluid out of the vagina, but I'm not even gonna call a name of the hospital, but because the patient did not want to go to a certain hospital, or she afraid of a certain hospital, she decided that she's not going to the hospital because she can't but go down at the hospital. And I'm telling you, like how she told me, she can't bother go down to the hospital because when she go down to the hospital, them are going to stress her out down there, and she'll go sit down on bench for hours and she can't bother, right? So the mommy called me, this lady called me, and she was like, "Midwife Nelson, I have some fluid that come out of my vagina, but I don't want to go down to the hospital. I can come to you, come make you check me if you tell me if I labor me in, or if me need to go to the hospital," right? And remember, whenever you're experiencing any other danger signals, do not stay at your yard, right? No, stay home. Don't stay home and watch anything. Just report to the hospital, right? So guys, we are at the end of another video. We are at the end of Midwives Minutes with Midwife Nelson. Yeah, guys, remember to like, comment, share, subscribe, and please comment below other topics that you would want to see me do for Midwifery Minutes, right? So until next time, stay safe, love you, peace out.